हेलो दोस्तों, मैं हूं स्मिता कुमार और आप देख रहे हैं आपका अपना हेल्थ चैनल मेडिसर्कल। क्या आपको पता है ओवेरियन कैंसर महिलाओं में होने वाला 8वां सबसे आम कैंसर है। करीब 78 यानी 78 महिलाओं में से एक महिला को ओवेरियन कैंसर होने का खतरा होता है। ओवेरियन कैंसर ज्यादातर 63 यानी 63 वर्ष से अधिक उम्र की बुजुर्ग महिलाओं में देखा जाता है। मेडिसर्कल आपके पास लाता है राइट इन्फॉर्मेशन सीधे एमिनेंट डॉक्टर्स और एक्सपर्ट्स की जुबानी, इसलिए इस चैनल पर आप हमेशा ऑथेंटिक कंटेंट ही पाएंगे। आपके लिए यह वीडियो देखना इंपॉर्टेंट है क्योंकि यह इंफॉर्मेशन देता है एक ऐसे फॉर्म ऑफ कैंसर के बारे में कि जिसकी ओर अगर आपका ध्यान समय पे नहीं गया तो वो शरीर को काफ़ी हद तक नुकसान कर पहुंचा सकता है। यह कैंसर है ओवेरियन कैंसर। महिलाओं में होने वाले इस कैंसर के बारे में हमने कई एक्सपर्ट्स, सीनियर डॉक्टर्स, ऑन्कोलॉजिस्ट से बात की। उनसे ये पता करने की कोशिश की कि इस बीमारी के लक्षण क्या हैं, सिम्टम्स क्या है, कारण क्या है और इसका ट्रीटमेंट कैसा है और किस तरह से प्रिवेंटिव स्टेप्स लेकर के हम इस बीमारी से बच सकते हैं। तो आइए वेल एक्सपीरियंस डॉक्टर्स से जाने कि वो इस बीमारी के बारे में क्या कह रहे हैं। अगर आप हेल्दी रहना चाहते हैं, बीमारियों से दूर रहना चाहते हैं, इफ यू वांट टू स्टे अवे फ्रॉम ऑल द डिजीजेस, स्टे ट्यून टू मेडिसर्कल, स्टे हेल्दी।
Ovarian cancer is the most common cancer, especially seen in elderly ladies. It is important to address ovarian cancer at an early stage. To ensure awareness among women about it, Medicircle is speaking to eminent gynecologists, oncologists, and obstetricians who have expertise in treating and dealing with such cases. Hi, I am Amrita Priya, and you are watching Medicircle. Today, our guest for the talk is Dr. Ranjana Dhanu. Dr. Ranjana Dhanu is an obstetrician, gynecologist, endoscopist, robotic surgeon, and infertility specialist. She is practicing at prominent hospitals in Mumbai, including Hinduja Healthcare, Reliance Foundation, Asian Heart Hospital, Breach Candy Hospital, Surya Childcare, and Sunridges Hospital. She is one of the most renowned minimal access surgeons in the country, with close to 25 years of experience, in which she has added a lot of feathers to her cap and has earned immense accolades. She believes in giving back to the society and has been involved in a number of social work initiatives over the years. So welcome, Dr. Ranjana, to Medicircle.
Hi, Amrita. Thanks for the kind introduction. And of course, in this pandemic, we're trying our best to see how we can get the message of good health and just try to alleviate any stress levels amongst our audience. So here we just start off with ovarian cancer now. So
yes. So to begin with, is ovarian cancer a hereditary disease? And if yes, what should women do if there is someone who has suffered in the family with it?
So Amrita, you can't really say hereditary, but you can say a genetic predisposition.
Okay.
And then those are the girls who are the high risk population. So if you have a first family relative, which could be an aunt, maternal especially, or a grandmother, or mother, or sister, or niece, then you fall in the first risk category. Okay. So those are the ones who can probably be slightly at a higher risk of ovarian cancer, plus patients who have suffered breast cancer.
Okay.
So second breast cancer, you can have Kuchenberg's tumors, which are solid ovarian tumors. So short of the long, these are the ways in which you can encounter cancer with a genetic predisposition, and you need to be vigilant. So we're going to cover all our topics. Once you shoot all your questions, then I'm going to really touch up all the dots and see that I leave you very well informed about ovarian cancer.
Okay. So our next question is, what are the symptoms and causes of ovarian cancer?
So understand that the female genitalia are lying low down in the pelvis. Understand that the uterus is almost like a small chiku or a pear. On the side are two little ovaries, which are like cashew nuts, and then there's the cervix and tubes and the vagina. So understand that these ovaries that are so small on either side, if they start to grow in size from the size of a cashew to a tomato, or the size of an orange, or the size of an apple, or the size of a muskmelon, we really don't feel that much of discomfort in the abdomen, because it's like two small cashew nuts in a shopping bag. The bowel contents, they adjust themselves around the ovaries. Now, if you go by the incidence of ovarian cancer and totally all the genital cancers, we say the highest ranking is that of the breast. But amongst genital cancers, it is the cervix, which is the mouth of the uterus, which is almost 86% of all genital cancers. 8% the ovaries, but more dreaded. Why more dreaded is because there's hardly any presenting symptom in the early part of the disease. Like I told you, that these ovaries, when they start to grow, they start to become cystic, they do not present with any specific symptoms. A patient with a breast lump will say, oh, I feel a lump, or I feel abnormal discharge. A patient with a cervical lesion will say, I have abnormal discharge. A patient with uterine body cancer will say, I have abnormal intermenstrual bleeding or postmenopausal bleeding. But somebody with an ovarian cancer may say nothing until the most dreaded thing, which is a stage 3, wherein it has spread into the abdomen and caused ascites. And that ascites is fluid filled around the ovaries and the bowel. And that is when the woman starts to feel tense in her abdomen and goes for a checkup. So that is the way to present. That is one. Second, it can be accidentally diagnosed on health checkups in patients who come in for routine health checkups. There are many times when we have patients with simple ovarian cysts, but they have a malignant component as well. So understand that anything that is big starts off as something small. So you cannot say, oh, it's a small cyst, so we leave it. So if you see a cyst, you get a sonography done, you get a vaginal sonography done, which has a better resolution, based on which you decide whether it's a simple cyst. If it is smaller than 4 centimeters, you follow it up immediately in a menstruating patient, post her next menses to see whether it's regressing. For any reason, if it's increasing in size, there are certain tests that are done in order to see whether there's any malignant potential in these cysts. So understanding the nature of these cysts is extremely important. So we have a test called the CA125, we have the Roma index, we have the CEA, AFP, HE4. So these are all advanced tests which tell us exactly what we're dealing with. And finally, if you see any abnormal parameters here, then we think in terms of doing an MRI. Now, why an MRI? Understand that a sonography is an end-on photograph of a potato. But if I have a facility to slice the potato into 120 sections and view each slice, that's exactly what an MRI does, and it's magnetic resonance imaging. So there's no radiation per se. And that gives you a lot of information whether you should be dealing with this conservatively or not. Understand that in ovarian cancer, there is no place for laparoscopic surgery in an established case of ovarian cancer. Benign ovarian lesions are all handled by us laparoscopically, but when it comes to cancer, it has to be an open job in order to do a complete job. And the earlier the diagnosis, the better the survival rates.
All right. And suppose someone has got the ovaries removed. So are there chances of cancer still?
Now, see, it's a very tricky question. When you say ovary is removed, I want to know whether it's a diseased ovary or a non-diseased ovary. In a patient, no disease in the ovary, and she's undergoing, you never undergo just removal of the ovaries bilaterally without a hysterectomy. I can understand a removal of an ovarian cyst if it's endometriosis or a dermoid or some other form of a benign pathology. But if you have a malignancy and then you have removed the ovaries, it all depends upon what stage have you removed the ovaries. Because for some reason, if there is spillage or if there is ascites, then the patient has to be followed up for a secondary growth of this tumor where the primaries from the ovary are removed. For some reason, when a patient has a hysterectomy for a non-diseased uterus and ovaries, then definitely there's no scope of developing any ovarian cancer.
All right. And what about women in general, like those who do not have any family history or something like that? what should they do in general to protect themselves from ovarian cancer?
So ideally understand that there are some ways that the body may signal, like I told you. Suppose it's a benign cyst, then it can be some pain or some torsion because it's like a water-filled balloon which is undergoing torsion. So you undergo a sonography. If it's a sonography showing a cyst, you have to be vigilant and follow it up till you see that it's regressing. You can't just say, oh, I did a sonography 4 years ago and the doctor said it was fine, so I've not done anything about it. So that's how you those follow up. For patients who have had a family history, we have the BRCA1 and the BRCA2, which you can evaluate. In patients with breast cancer, you can see whether they have a predisposition towards ovarian cancer. But imaging is extremely important. And I feel a sonography, a transvaginal sonography with a good probe really gives us a lot of information than doing an abdominal ultrasound in an obese patient. It's easier to do a vaginal sonography wherein you can get a better resolution and see the morphology of the ovaries. We have a Doppler flow, which gives us a lot of information about the ovaries. So all these investigations, which are non-invasive, can definitely in diagnosing disease early.
Okay.
The symptoms can be very vague. There can be just a vague dyspepsia or a sudden feeling of bloating, maybe not. So it can be very relative. So we feel all women after 45 years should undergo sonography annually to check whether there's anything growing there or not. Any patient who's had a previous history of a cyst in the ovary, could be an endometriosis or a simple serous cystadenoma or a mucinous cystadenoma. These are not very big terms. It's just that they're benign lesions or a dermoid. Now, what is a dermoid? A dermoid is in the ovary, which is benign, but it appears from all the layers of the body. So understand that our body is made up of ectoderm, endoderm, and mesoderm. So a dermoid is totipotent, wherein it has elements of all the three. So ectoderm, endoderm, mesoderm. So in a dermoid, you will see on sonography features of fat, bone, teeth, hair, all of it in that cyst. So the benign variant is a dermoid, but malignant can be a teratocarcinoma. Similarly, a benign cyst of the ovary, a simple cyst can be a serous cystadenoma, or it can turn into a serous cystadenocarcinoma. So when you start to see on a sonography certain features of solid elements or something stuck around the ovary, or you see that the omentum, which is a curtain, a fat curtain, the abdomen getting thickened, or you see fluid around in the abdomen, those are ominous signs that need to be looked at immediately.
All right. So as far as the lay person is concerned, she should be kind of alert about the different small changes that are.
Also, after the menopause, you need to watch them every year with the sonography in order to see. And of course, if patients have had a breast cancer, definitely once there is sonography to follow up the ovaries to rule out any Krukenberg's tumor.
Okay. All right. So nicely explained, Dr. Dhanu. I'm sure your insights is going to make women understand about what ovarian cancer is, because it mostly affects women at a later stage. So many young people are not aware of it and they do not pay much attention to knowing about it.
So very unfortunate that I have seen a 15-year-old in the last month who has come to us with a huge ovarian tumor, which is cancerous. So today, with all in the dietary patterns, kids indulging more in processed foods. I don't want to blame any particular company for making all the processed snacks or foods, but I feel a strong message that go down to society is that please indulge in natural foods, unprocessed, unhandled foods. Keep your lifestyle simple, exercise, diet, lifestyle modulation, yoga. All this helps in circulation in the body, because we are seeing a lot of adolescent ovarian tumors as well. So do not think that ovarian tumors can hit only the elderly.
Okay.
So this girl typically presented thinking, oh, it's lockdown and she's probably putting on weight and stuff like that. But when we did a sonography, we were not really happy. And it's very sad because she has full-blown ascites. So now she's undergoing chemotherapy till we dry up the fluid around the ovaries. And then we're going to subject her to open hysterectomy, where the poor child at that tender an age is going to have all the organs out.
Okay. So that's very sad, and that is why awareness among women is very necessary, so that they are alert about small changes. Yeah.
We always feel that in younger patients who are keen on fertility and we see some issues, there is also a chance of egg storage. So depending on an index case, depending on the disease, you can probably store your genetic material, but the earlier in the disease you contact it, the better. We have another patient who had come into us from Bangalore, and believe me, during lockdown, she just thought she was putting on weight again. And when she did a sonography, we found a huge cyst almost going up to the liver.
Oh my God.
And when we did her test, we saw that it was a benign lesion, but we actually had to drain out her cyst, and we drained out 11 liters of fluid.
Oh my God.
11 liters of fluid, after which we took the cyst into the pelvis. We removed the cyst wall. We kind of restructured the ovary because this patient has not undergone any childbearing yet, and she's all fine. And within 48 hours, she's gone home just with keyholes on the abdomen. So that's what I'm telling you, that if it's a benign lesion, we can do anything to see that it's a minimal access surgery and the patient goes home well. But once you see a malignancy, then it becomes very difficult to handle it with minimal access surgery.
Yeah. So thank you for your insights, Dr. Danu, and thank you for making us aware of these high alert cases, because some of us are not even aware that it can affect girls so early in life. And with simple lifestyle measures, women of all ages can kind of keep this at bay. So thanks for all your insightful information. Thanks for being part of the Medicircle show.
All the best to you, all the best to all the audience who are witnessing this program. And I wish you all again a very healthy 2021 of whatever is remaining. Again, I emphasize on everybody taking the vaccine, though it is out of this topic. But let me tell you, at least the pandemic will have a lesser influence on your body. If you take the vaccine, you'll be able to fight the disease better. The way things are going in the country, not really good. So you need to be vigilant. So all the best. I wish you all good health and stay healthy.